Welcome to Please Me, the award-winning bilingual sexuality podcast bringing you bold conversations and big clit energy. Sí, Please Me tiene subtítulos en español. I'm thrilled to announce that Please Me is the #1 ranked sexuality podcast in the USA and worldwide. And welcome to Season 6. I'm Eve, your host, on a journey from trauma to sexual liberation. Join me and my guests as we dive into conversations around orgasm equality, self-love, body positivity, and essential sex education. Let's reclaim pleasure and close the orgasm gap, one empowering conversation at a time. If you missed part 1 of my conversation with urologist Dr. Stephanie Zwonitzer, be sure to go back and listen before diving into part 2, where we break down common sexual health issues affecting men and women and wrap up with a fun role play, sure to love. Huge thanks to everyone who's rated, reviewed, and shared Please Me. Because of you, we're now the #1 sexuality podcast in the US and worldwide. Your support amplifies vital conversations about pleasure, healing, and sexual empowerment. Keep the momentum going, leave a review, share your favorite episode, and help us reach even more listeners. This week, I'm shouting out 5 amazing countries where Please Me hit #1. Japan, Bulgaria, Jamaica, Serbia, and Argentina. Thank you for tuning in and turning up the volume on pleasure. I'm also raising funds for survivors of the devastating magnitude 6.9 earthquake in the Philippines. My editor, who is based there, and her community were deeply affected. She recommended a trusted organization that provides long-term aid to those impacted. Please check the show notes for the donation link. Any support you can give is truly appreciated. Want to ask me a question for the Please Me podcast? Join the conversation on Patreon or subscribe to my Substack newsletter. Both communities give you access to exclusive content, updates, and the chance to have your questions featured on the show. Please Me is for mature audiences, so sit back, relax, and surrender to the pleasure of Please Me.
Running a business comes with a lot of what-ifs. But luckily, there's a simple answer to them. Shopify. It's the commerce platform behind millions of businesses, including Thrive Cosmetics and Momofuku, and it'll help you with everything you need. From website design and marketing to boosting sales and expanding operations, Shopify can get the job done and make your dream a reality. Turn those what-ifs into... Sign up for your $1 per month trial at shopify.com/special offer.
We all love a legendary comeback, and Degree Original Cool Rush is back and better than ever. Cool Rush isn't just a scent, it's a movement, a fan favorite that delivers bold, fresh vibes and all-day sweat protection. Whether you're heading to the gym, the office, or just trying to stay fresh on a long day, Cool Rush has your back. So if you haven't tried it yet, head to your local Walmart or Target and grab Degree Cool Rush, the fan favorite scent from the world's #1 antiperspirant brand.
This episode is brought to you by Progressive Commercial Insurance. Trucking is a big job, so Progressive is proud to offer truckers the coverage they need and discounts to help them save. Quote truck insurance in as little as 8 minutes at progressivecommercial.com. Progressive Casualty Insurance Company and Affiliates. Discounts not available in all states or situations.
Yeah, great question. So as far as the vaginal estrogen, as soon as you start noticing any symptoms, whether it's smaller labias, increase in frequency and urgency, increased dryness, all of a sudden you need more lube, or you've never needed lube and now you do, as soon as you start experiencing those, get on some vaginal estrogen. So that can be as early as your late 30s. You can also do it when you're like postpartum to heal all those tissues and get them back. But definitely early 40s and beyond, you should be on vaginal estrogen.
ASN Lifestyle Magazine is your go-to source for sex-positive, sophisticated content covering everything from the swinger lifestyle and adult entertainment to intimacy, wellness, and more. You can read every digital issue for free, and subscribers get access to exclusive content. See the show notes for the link to subscribe and check out their Instagram. I'm excited to share that I now have a monthly column in ASN called Big Clit Energy, a Please Me series. Don't miss it and subscribe today. Welcome to Season 6 of Please Me, the podcast that aims to destigmatize conversations about sex and sexual health by turning the sheets into our classroom. I have Dr. Stephanie on the show for part 2 of our episode. And at the very end of our episode, we were talking a lot about the female issues that women can experience if they have low estrogen, for instance, like frequent UTIs, even incontinence. So let's go back into that topic, because I want to talk more about why a woman would experience frequent UTIs. What would cause that in women?
Yeah, so honestly, it is it's multifactorial, but one of the biggest reasons is the decrease in estrogen and how thin the tissues get when there's not estrogen in there. So the bacteria can get through a lot easier. And when the tissues get thinner, we have less blood flow, meaning we have less fighter cells going into that area to prevent the infections. And then with the decreased lubrication from having low estrogen, we have less pushing the bacteria away from us. And some women, they have stasis urine because they have a prolapse, and so they don't fully empty. And so there's some various things, but the low estrogen is the biggest cause. And so if we can replace that, the research shows that anywhere, it just depends on which study you listen to, but anywhere between 60 and 80% reduction in postmenopausal recurrent UTIs just by putting some vaginal estrogen in. Not to mention all of my other tips and tricks that I give my ladies, but that one intervention alone can make a huge difference just with frequent UTIs, but also with the pain with sex, the discomfort, the frequency and urgency, all of those things.
Yes, I'm going to just bring up a personal experience of mine, because I like to recommend a product called Parlor Games, and I use their estrogen cream that's topical, and it goes just like you mentioned in the last one, on the vulva and the clitoris and inside the vagina, like at the beginning of the vagina. So when I started using that, because I was experiencing a lot of perimenopausal and menopausal symptoms, and I was having a lot of dryness and frequent UTIs, right? And also incontinence, okay? And I'm not ashamed to admit it. I would sneeze and I would pee on myself. I would laugh hard. I would pee on myself. I would jump rope. I would pee on myself. And I was freaking out. I'm like, this is not good. It's not a sexy condition. It's, one of those like unsexy sexual health conditions. And for me, about a month into using the topical estrogen, my incontinence disappeared.
Mm-hmm.
So estrogen is such a key component to having a strong vaginal, strong vaginal tissue, right?
Yeah.
So that we don't have all of these issues. Do you want to just speak on that a little bit?
Yeah, absolutely. It's incredible how much it helps. I mean, I have women who come in thinking they have overactive bladder because they have frequency, urgency, and incontinence, and the bladder medicines don't work. Well, yeah, no kidding, because that's not really it. It's you don't have estrogen. Your body needs estrogen to function correctly. It's lived on estrogen for the first 50 years of its life. And so, that's really important. The strength of those tissues is one thing, but then having the increased lubrication, elasticity of those tissues, so now they can absorb more urine before it needs to pee out. The sphincter gets, better blood flow and better thickness to it, so you can close better. And as you reinvigorate that entire area with better blood flow in your exercises, and the estrogen, then everything tightens better when you need it to, and you can hold your urine. You can relax when you need to void and get everything out at once instead of having some left in your bladder. So it's really important on multiple different levels.
Absolutely. Estrogen is miraculous.
It is.
And,
It's amazing.
And that, and that leads me back to hormone replacement therapy for women, right? And oftentimes we go to our doctors and we say, hey, we need hormone replacement therapy. We're having frequent UTIs, we're having, incontinence, etc. And they're like, oh, well, you're not in menopause yet, so you can wait. When do you recommend hormone replacement therapy for women?
Yeah, great question. So, as far as the vaginal estrogen, as soon as you start noticing any symptoms, whether it's smaller labias, increase in frequency and urgency, increased dryness, all of a sudden you need more lube, or you've never needed lube and now you do, as soon as you start experiencing those, get on some vaginal estrogen. So that can be as early as your late 30s. You can also do it when you're like postpartum. to heal all those tissues and get them back. But definitely early 40s and beyond, you should be on vaginal estrogen. Now, systemic hormone therapy with estrogen, progesterone, and testosterone, that's different. And I'm not going to speak too much on that only because I'm still working on my certification. So it's just not my jam quite yet. But that's also an area that lacks in education. And you need to really seek out a provider that knows what they're doing, because we are not taught it in NP school, med school, any of those. We're not taught hormone replacement therapy for women. And so it's really those of us that care about our ladies enough to go get this extra education and certifications. We're the ones that are going to put out there how to help you. And so I don't want to speak on it too much yet, just because I don't want to misquote anything, or provide anything that's not accurate. But as a female, you should be getting multiple hormones, not just one. And if you have a uterus, then you need the progesterone and the estrogen. If you don't have a uterus, sometimes you can do without the progesterone. And so again, it's huge. It's impactful for your energy, your sex, your overall health. Estrogen has been proven to help decrease your risk of dementia, to decrease your risk of cardiovascular events. It's phenomenal. I just can't speak too much on exactly how you should do it yet.
Well, I'm going to say that hormone replacement therapy really should be targeting our symptoms, right? So if you're
Yes.
starting to have symptoms, go to the doctor and ask for a blood panel to see where your hormones are. Because even if you are perimenopausal and you haven't completely, exited the period merry-go-round, right? You can still get hormone replacement therapy if your levels are low. So definitely go to a doctor, and I commend you for going to get more training in this area because it's so important for women. And oftentimes, women are last to get treatments because a lot of doctors just don't know what to do. So it's so essential to know for ourselves that if we are having symptoms, and there are multiple symptoms that can happen for perimenopause and menopause, so many symptoms. I mean, there's a lot. And if you're having lots and lots of symptoms, go see your doctor, get your blood work done, and see where you are and if you qualify for hormone replacement therapy. And, for me, I had to pay out of pocket for it, and I do. And it's not cheap.
It's not but cheap. It's important.
Yeah. It's so important. And one of the things that I found for myself is that, one of the symptoms is joint pain. And I had severe joint pain in my right hip for years and years, so much so that I thought that there was something wrong with me. I went to an orthopedic doctor who found that I had a torn labrum after they did an MRI and suggested surgery. And I had hip surgery on my right hip. And when they went in, there was no labrum tear. And guess what? It was undiagnosed or improperly diagnosed perimenopausal symptoms that I had started having in my early 40s and continued until I started taking hormone replacement therapy. So listen to your body and seek the help that you need. Even if the first doctor doesn't get you there, find somebody else. And I know, not a lot of times people can afford to do that over and over again. So I understand that there's limitations as to what we can do, but seek answers because there is help out there.
Absolutely. And it's like we talked about with the men with low testosterone. It's not about a specific number because that's such a one moment in time. It's your symptoms as well. And it's optimizing you, right? So just because your levels are considered normal, they might not be normal for you. And for women, especially because we go through cycles, you most likely are going to need your hormones tested a few separate times to get an accurate picture of what's going on and what phase you're in. And the other thing that I would suggest is, as much as I hate when people leave me nasty Google reviews, but they also leave me good ones, go and look up the provider you're going to go, because you will see the good, bad, and the ugly on their reviews. Whether it's that their staff was slow or they were too slow or quick or whatever, you'll read about that and you'll see, if they have 10 reviews and 7 of them are positive. This person knew what they were doing, whatever. And the other 3 are like upset because there was bad parking or whatever. Like, we can't control what the reviews
Right.
are, right? Like, I've had people leave me horrible reviews that had nothing to do with me. So we can't control that. So that's what I'm saying. Use your discretion, but look at the reviews, because that will help you maybe not go to 4 different docs. Maybe it'll help you go to 2 before you find your right one.
Absolutely. And I want to talk about prevention, because I
Mhm.
feel like a lot of times people wait till they're too far gone, right? To go to the
Yeah.
doctor, and they have massive sexual dysfunction, like, severe erectile dysfunction, or, they have a prolapse going
Yep.
down there because they have just sort of ignored it for so
Mhm.
long. And I think that preventative medicine, especially for sexual health, is so important so that we can maintain our sexual health throughout our lifetime. Do you want to just talk about what you recommend so people don't lose their sexual function? And we did talk about masturbation earlier
Mhm.
before. That's like the first thing that I recommend, is masturbating regularly. But what other ideas do you have?
Yeah, absolutely, masturbating regularly. And please don't make it a thing about feeling guilty that you're doing it, or, you can be in a very loving relationship and having a great sex life and still masturbate. Just have a lot of orgasms. There's actually research out there that shows that men who orgasm 21 times or more in a month have a 20% reduction in prostate cancer than men who only
Yes.
ejaculate 7 times a month. So, ejaculate. Um,
and
but
and women too,
yes.
because you need to practice. And like we said before, if you don't use it, you'll lose it.
Use
And we
it.
don't want to
Yep.
lose our function. We don't want to get atrophy of our vagina or our penis, right? So
Yeah.
continue.
Yep. Yeah, absolutely. And so, yeah, exercise is number one. For women, your pap smears regularly to make sure that you're healthy in that regard, and not developing any growths or anything. I mean, even if it's not the HPV, you can still get polyps, you can get fibroids, you can get all kinds of stuff that we can deal with. So, definitely have regular GYN exams. If you do start having any urinary issues, get a urologist on board. Gynecologists are not urologists, and urologists are not gynecologists. We specialize in very specific things. And so, for your vaginal issues, you want to go see them. I do some of it, but mostly you're going to want to go see gyne. For your peeing issues, mostly you're going to want to see me. They might be able to get you started, but you want to see a urologist. But there's not really a specific like age for women where I would say you need to have a urologist on board by age 40. Just really, as soon as you start to see anything changing down there, get in and start seeing us so we can get you on the vaginal estrogen and stuff like that. So for men, it's a little different because we got the prostate involved. Keep your cardiovascular healthy. So if your blood pressure starts going up, if your cholesterol levels start going up, get those fixed. If your blood sugars and you're starting to get close to diabetes, get that under control, because diabetes affects both your nerves and your sensation as well as your blood flow. So those can really affect your erections, as well as the medicines that you take for those can affect your erections. So if you get those under control and you can diet and exercise your way out of them, you're going to be better off in the long run, because you're also not taking the medicines that can cause ED. And then, so for men, starting to see a urologist probably between age 40 and 45. Anytime you start having urinary issues, we want to see you to make sure that the prostate's healthy and start getting it treated when it needs to be. Specifically for prostate cancer, if you are of African descent or you have a family history of prostate cancer, you should start getting checked between age 40 and 45. If you are any other ethnicity and have no family history, then between age 45 and 50, you can start having your prostate checked. But the biggest, yeah, I go back to, if you don't use it, you lose it. That's the biggest thing for the sexual health in and of itself.
100%. Yes, prevention is so important. And I often have patients come to me for erectile dysfunction, and I
Mhm.
do acoustic wave therapy for them. I also do dry needling. Any thing you want to talk about in terms of those things? Because we talked about blood flow. We didn't really get into a lot of detail, but acoustic wave therapy can be used for men and women to increase blood flow and to break up any blockages that are in the blood vessels in the genital area and the surrounding tissue. And so it's so key to really continue to keep that blood flow going. And that's something that can be used for preventative
Yeah.
purposes. Do you want to just speak on that
Yeah.
a little bit?
Absolutely, because a lot of times by the time guys come to me with ED, recommending acoustic wave, sound wave, however you want to refer to it, it's really not going to be helpful as much anymore because they're past that, right? If they had been doing it early on, they could have prevented getting to this point. But once you're really needing high doses of ED meds or injections, the acoustic therapy isn't going to do enough to get you back to where you were without needing intervention. So I love the prevention side of it. I think that's amazing. Or if you come into me and you're like, yeah, it's like intermittent. Sometimes I lose it, sometimes I don't, things like that. Definitely, going to talk to you about sound wave therapy, and maybe some like low dose Cialis to just get a little extra blood flow while you're working on that. So I think that's huge. I haven't used it as much in my women. It's not very prevalent around us, in that area, but I think it's a great option. I love that you can do that for your women as well.
Yeah, absolutely. I mean, blood flow is so essential for women too, and that's why we get
Yeah.
dryness, right? And we get
Mhm.
decreased sensitivity. So this treatment can help to increase that sensitivity, increase the blood flow so that you can be more wet. And
Mhm.
also over time, it actually increases capillary formation. So for men and women, it actually is going to increase blood flow generally over time
Mhm.
when you get multiple treatments. So
Yeah.
um, thank you for covering that a little bit. And I want to talk about anal sex,
Yeah.
um, because, you know, the pelvic floor is right there too, right?
Yep.
And sometimes if you have tension in that area, anal sex can be very painful. So,
Yes.
how, hold on just a second. I'm not even sure what question I was trying to ask. Okay. All right, so edit this part out, please, Gardenia. The point that I'm trying to make here is anal sex, can it cause problems with the
Mm.
pelvic floor? Can it cause damage or can it cause issues?
So, great question. If you do it right, no. One of the biggest things that you need to do is use more lubricant than you think you need to use because that should slide right in and out. The other thing is prep work. That needs to warm up. So, you could talk about anal sex with men or women, but if you think about a female vagina and how it needs to elongate and it takes time for that to happen and that lubrication, think of that same thing with the anus. Play with it with your finger, lube it up, get it warmed up, maybe stick the finger in and out a little bit, or maybe an anal plug, something like that to kind of warm it up. Once you are good and relaxed, that's when you can consider penetration. And you really you could there are lubes that have like lidocaine kind of jelly in them to kind of numb you up a little bit. So if you do tend to have more pain, and it's not as pleasurable for you, then you might want one of those lubes. And then the other thing is there's great anal trainers that you can wear. They're butt plugs essentially, but they go up in sizes, and so you can wear a size, maybe wear it for like 10 minutes a day for a week or two, and then move up to the next size and move up to the next size. So you're actually teaching your anal sphincter to relax to those sizes, which is really a great way to do that. And then the other thing that I think about is just slowly introducing penetration. If you are, relaxed and ready, drop your jaw, open your mouth and drop your jaw. I had a friend of mine tell me that if you clench everything, your butt's clenched. And if you
Yes.
relax everything, your butt's relaxed. And so
Hmm.
think like it's so crazy. When you got your butt up in the air and you're like ready to go, and you're just like, oh, relax your mouth and your tush is going to relax too. So that really helps, just thinking of relax, relax, relax. Sometimes if you push back while they're pushing in, you can kind of get everything to relax at once. um, Medically, I should not recommend poppers, but those are out there as well that can help you relax. A little sniff on that, and that can help as well. I know that from a lot of my friends in the LGBTQ community, and I love that for them and anybody else that wants to try it. But yeah, just warming it up is probably the biggest thing, and then using plenty of lube.
Yes, and I love that you bring up lube, and I feel like we need to ask for lube more often than not, and not
Yeah.
just for anal sex, but for vaginal sex too,
Yeah.
right? Because lube makes everything better, whether you're 20 or you're 70. It doesn't matter.
Yeah.
Lube is your friend. And if you're going to have extended sex, we don't want quickies, right? At least I don't like quickies. If you're going to have extended sex over the period of time, your body may not be able to produce the right amount of lubricant, to keep it going for a long period of time without having some little dry spots that can then cause tears and then can cause pain. So lube it up. Every time you switch positions, throw a little lube on there, I love lube for that. And so,
and don't be embarrassed. There's nothing wrong with you if you need lube.
Exactly. And for anal sex, it is absolutely essential. You must use lube because there's just no lubrication or enough lubrication down there. It's not produced the same as the vagina. So it's super, super important. So I love that you bring that up.
And if you after you've gotten torn, not fun.
Right. I mean, if you're having anal sex and it causes hemorrhoids and it causes damage and fissures and all of that, you're not going to be able to enjoy sex for a really long time. So it's super important that one, you use lots and lots of lube, and two, you prep it. And I love the idea of having the butt plugs and graduated sizes. That really does help to sort of open things up and help your body to relax into those new positions so that you can eventually accept some penetration. So thank you for going into that maybe uncomfortable topic that I don't think a lot of people like to talk about. But hey, I wanted to talk to you about it because I think it's so important. And anal sex can be wonderful for both men and women.
Hi, it's Eva Longoria, and let's be real. After 40, we should ask for more from our skincare. I swear by Revitalift Triple Power Moisturizer by L'Oreal Paris. With vitamin C, pro-retinol, and hyaluronic acid, it reduces my wrinkles, firms, and brightens. And it's not a procedure. It's just a hardworking moisturizer.
Revitalift Triple Power Moisturizer by L'Oreal Paris. Grab it today in fragrance-free or with SPF 30. Available at your local Walmart.
This episode is brought to you by Progressive Commercial Insurance. Trucking is a big job, so Progressive is proud to offer truckers the coverage they need and discounts to help them save. Quote truck insurance in as little as 8 minutes at progressivecommercial.com. Progressive Casualty Insurance Company and Affiliates. Discounts not available in all states or situations.
A lot of people get pleasure that way, and pleasure's number one.
Yes, we want to definitely, we're pleasure advocates. So we definitely want to advocate for all the types of pleasure, including anal sex as well. I want to just talk a little bit about low sperm count and low libido. Is there any correlation between the two?
Mm-hmm. Oh, great question. Honestly, not that I'm aware of. Low libido is generally more low testosterone, which if you have low testosterone, you could have low sperm count, but not necessarily. They're not directly correlated, but they can, if you have low testosterone, you're not getting pregnant, you're not getting someone pregnant, you might want to get your sperm count checked. But there are, the flip side to that is, if we replace your testosterone with synthetic testosterone, it makes you sterile. So there's kind of some caveats there in what we really need to be careful of. There is a medicine called Clomid, which a lot of people are familiar with for women going through infertility treatments. But in men, we can give it to them with low testosterone, and it helps increase their testosterone naturally, which can then in turn help them with getting pregnant if they do have a lower sperm count. So there's some connection, but it's not completely.
Okay, very good. I was just curious because, a little previous history of my own, wanted to know about that. Anyway, let's talk about our role play because we are at the point of the role play, and I love this part of the show. It's just a unique thing that I do on my show where we model conversations around uncomfy topics, right? And so this season we're doing role plays about an icky thing, right? So, something that gives you the ick, right? And so today I'm going to be talking about going to the doctor. Dr. Stephanie is going to be my doctor, and I'm going to be going to see her. So I'm going to be her patient. She's going to be the doctor, and I'm going to her. Well, I'm not going to tell you exactly why, but I'm going to her for an issue that I'm having. And so with that being said, any questions or anything? Are we ready?
Let's do it.
Let's do it. Okay, here we go. And action. Okay. Hi,
So
Dr. Stephanie. How are you?
I'm well, thank you. How are you? What's bringing you in today?
So I'm really embarrassed to talk about this. I mean, this is just, I'm kind of mortified actually, to be honest with you. But I was having sex with my partner and he stopped like in the middle of it and was like, there is something going on down there and it smells not right. And
Okay.
so I want to know what's going on because I have no idea why I would smell any differently than any other day. But I do notice it
Yeah.
too. Like I had noticed it. I just didn't, I just thought it was sort of my like natural, obviously we change throughout the month. So I just thought it was my natural, smell.
Yeah, great question. So sorry you're going through that, but glad you came in because this is definitely something that you should get checked out. Really, the vagina shouldn't smell too much in any which way, good, bad, or indifferent. So let's have a look and see. While we're getting all situated here and I'm getting under the blanket with you, are you having any changes in your discharge?
I haven't noticed any changes in my discharge. It's been
Okay,
just
good.
regular.
Okay, sounds good. And how long do you think you've known that this has been going on?
I've noticed it for maybe a week or so, but
Okay.
I just didn't really think much about it.
Yeah, okay. And did your boyfriend comment or your partner's comment on what the smell was like? Was it fishy or ammonia? What did it kind of smell like?
He didn't say.
Okay. All right. Well, let's go ahead and do the exam. Lift the blanket up. Oh,
Okay.
okay. So I'm going to look inside here and I can already tell, yes, you have an odor. It's kind of a fishy smell. Let's get the speculum out. We're going to look inside. So just relax while I put this in and get some lubricant on it. Go in. Oh, all right. When was your last period?
I just had my period about a week and a half ago.
Okay, well, I think I found the culprit here. You have a tampon inside of you, so you must have missed one in there at some point.
Oh my goodness. Are you serious?
Yes, and don't even worry about it because you're not the first and you won't be the last. So we're going to get this out of here, get that taken care of, and we're just going to give you a week's worth of antibiotics. That's going to take care of this. It's called bacterial vaginosis. Very common, happens for different reasons, and this is certainly one of the reasons. So we'll get you all fixed up.
Oh my gosh. This is so embarrassing, but you're right. I probably just left it in there and didn't realize.
Yeah, it happens more than you think it would.
Wonderful. Thank you so much, doctor.
Oh,
And
you're welcome.
scene.
Yeah, that happens so frequently. It's happened to myself. I've taken them out of patients. And it's you feel so embarrassed and so stupid. Like I put it up there. Why didn't I think about taking it back out? But yeah, it just happens. We get busy or you think you took one out, you put the next one up and then the
And then
first
you've
one
got
got
two
stuck up
in
there.
there.
Yep, and you don't think
Exactly.
about it. Yeah, so
Exactly.
happens all the time. Anytime you have a weird smell down there, come get seen. We'll check you out.
Absolutely. And I'm not going to lie, it's happened to me too. It has happened to me too. And I found it myself. It wasn't with a partner.
Yeah.
I realized that I reached in and I was like, oh, this is the problem.
Yeah.
So tell me a little bit, let's just before we jump off of this topic, because you can get bacterial vaginosis just from, you know, having bacterial vaginosis. Tell
Yeah.
me what sorts of things would cause that, because it's not just getting a tampon stuck inside of you. You can also
Right.
get it for other reasons.
Yeah, one of the biggest reasons is sex.
Yeah.
The exchange of bacteria down there, especially if you have the ejaculate of your partner in you. So if you have a penis partner and they ejaculate inside of you and you don't get that cleaned out very well, that can cause BV. It's very common. It's actually more common in women who are sexually active than women who are not. But it can be, yeah, from a tampon or if you use a not really a safe lubricant, maybe one of those flavored cheap lubricants. You can get it from that. From if you've had a use of antibiotics or had a yeast infection recently, things like that. Anything that throws off your pH can make you susceptible to BV. One of the biggest things I'll say is things like Vagisil and Summer's Eve vaginal washes. Please do
Yes.
not use those.
Yeah.
I can guarantee you will get BV. And the reason they sell them is because as soon as you stop using it, you start to smell the fishiness. So you start using it again, but you never got rid of the BV. You just masked it while you were using their product. So don't use those. It will absolutely give you BV. Use just plain old water to wash the vagina. And that's the best thing you can do.
Yes, and I want to just mention boric acid too, because
Yeah.
if your pH is thrown off, right, boric
Mhm.
acid can really help. So having those suppositories on hand is something that I think is really essential. At
Yeah.
least I know that I use it frequently. So do you want to just speak on that?
Yeah, so boric acid is great for rebalancing the pH, whether it's after your monthly cycle, after a really long sex session. Maybe you didn't get the semen cleaned out of you, something like that. If you have a smell or something, I don't like a regular use. I don't want you to use them just because you want to use a boric acid once a week or something. I like it when you use them because you're having an issue. But they can really help, get things back on when you've been off.
Okay, so great points there. Definitely use it as needed,
Hmm.
for sure.
Yeah, I did have someone come in that they were using it like on a daily basis, and she was
Oh,
just
wow. No.
so raw internally because it's just too much. And she didn't know any better because nobody had taught her. And she thought that was the way that, instead of douching, she was using the boric acid. And it's acid. You have to be careful with how you're using it.
Exactly.
Mhm.
Exactly. That's a good point. Well, I want to thank you so much for being on the show today. And I want to make sure that my listeners can find you. So we were going to definitely put everything in the show notes, but tell us where we can find you.
Absolutely. So my website is betweenthe.sheets.com. And so is my handle on all the different social medias, betweenthe.sheets.com. And then you can find my podcast, which is called Between the Sheets, on any of the podcast host sites that you go to, Apple or Amazon or wherever. And your host was on there as well. So you'll get to catch her episode on there too. So yeah, Between the Sheets with Dr. Z.
Amazing. Thank you so much. And I want to make sure that my listeners can find me as well. You can always find me on pleaseme.online. That is my website. And I'm just looking for it here and I don't see it. Okay. Just one second. Oh, here we go. I should have done this for you too. Edit all of this, please, Gardenia. Okay. So you can find me on pleaseme.online and you can go on there for so many different things. Check out my site. It's a wealth of information. It was actually nominated for a Best Education Website Award. And so there's a lot of different information on there. I want to also mention that Please Me is now #1 in the United States and worldwide. So yay, so exciting. And I am
That's
looking for
amazing.
nominations. Thank you. I am looking for nominations for the Webby Awards. The Webby Awards are the Academy Award for podcasters. So if you are interested, if you're a longtime listener or even someone that, has just listened to this show and really love it, and you want to nominate me for a Webby Award, look at the link in the show notes and please, think about nominating me. I think it would be really amazing to hold one of those awards in my hand. So,
Yes, yes.
So with that being said, thank you so much for being on the show today, Dr. Stephanie. This has been such a great conversation.
It's been amazing. Such a pleasure to be here. Thank you for having me.
Until next time. I want to personally invite you to join me on Patreon for ad-free listening, bonus episodes, and early releases. Already, there is a lot of bonus content on there with many webinars that I've done in the past and a show that I've never released to the public before. My show is completely self-funded, and when you are able to support me in this way, I'm able to spread my message of body positivity, self-love, and women's empowerment, and empowerment in general around sexuality around the globe. And so with that being said, I appreciate everyone who has already joined Patreon, and if you've thought about joining, now's your nudge to do so. I thank you from the bottom of my heart.